Let me start with how thrilled and hopeful I am these days regarding the treatment of schizophrenia. Because in my early days in this field, in the early 90s, there were very few medications. Many people would stop being med compliant because the side effects like tardive dyskinesia were so profound that people would just get off their meds. And we used to joke like people with schizophrenia are positive for everything but their meds. They would medicate it with drugs and alcohol. So schizophrenia is this, and sometimes it makes it pretty easy to tell the difference between this and maybe some other psychosis that's induced by something. Schizophrenia has two parts to it. It has positive symptoms and negative symptoms. The positive symptoms are the traditional things that we mostly think about with schizophrenia. And that is hallucinations, which include like visual and auditory hallucinations, and delusions. So visual and auditory hallucinations, hearing things and seeing things that the rest of the people, most people around them are not experiencing. They're not seeing that. And then delusions, believing things about yourself or the world or other people that don't fit other people's narratives. Like I might say, I'm Christ and I'm here for the second time. The FBI is spying on me. I have things implanted in my brain. Those might be delusions. Or I'm able to influence people, or I have telekinetic connections to people. Those might be delusions. And the hallucinations might be I'm seeing people, and I remember hearing things. So those are the positive symptoms of schizophrenia. Here are the negative symptoms. Without the negative symptoms, you can't diagnose somebody with schizophrenia. And this is where you can frequently tell the difference. Over here, the negative symptoms are just the dissolution of the self. This is where somebody's talking word salad. They're talking and it doesn't make any sense. They lose the ability to have goal-directed behavior. Their behavior just isn't accomplishing anything. Many people with schizophrenia throughout the years have ended up homeless. They're that person that's talking to the lampposts and you're like, what in the world are they doing? They're not able to take care of themselves. Their hygiene falls apart. Those are those negative symptoms, which we may not and frequently don't see with like a drug-induced or cannabis-induced psychosis. We see a lot of cannabis-induced psychosis here at New Roads. So that's one way we can differentiate. Sometimes though, we just need time. We need time in a controlled environment where that person just has no access to drugs or alcohol. If the psychosis is still there, then we can pretty confidently say that psychosis is attributable to something else, like schizophrenia. And then if we're seeing the negative symptoms, then we say, okay, for sure we have people with schizophrenia. I do want to say that there's those jokes like, hey, I'm schizophrenic and so am I. It's more related to dissociative identity disorder. That is not schizophrenia. So there's a misconception sometimes that multiple personalities are related to schizophrenia, and that's not accurate. I think if you're choosing a treatment center and the person is psychotic and you also know they're using drugs, I would definitely choose a place that could adequately treat both. That's going to narrow your choices. Who has some pretty important pieces. If it turns out that this person does have schizophrenia, then that program needs to have some type of ACT team or assertive community treatment, which is really good case management, really good skills development to help this person get their hygiene back on track, help them get to a place where they can maybe even work and have good strategies for intervening as the medications are taking effect so the person doesn't walk out the door. I think it's really important that there's a lot of psychiatric sophistication, and they could treat SUD. If it turns out that this is a cannabis-induced psychosis, can I treat that? We can't promise this for everybody, but the medications today, based up versus what I was first introduced to in my early days in this field in the 1990s, people, so many of them are leading wonderful lives. Yeah, you would not know that they have schizophrenia. You might pick up that they're a little odd and you might not. And some people respond very, very well to the right medication. And it's just so awesome that we have the medications we do today.